Hi everyone, the Health Minister Dr. Zweli Mkhize has just put out his statement for the day and it's very interesting. He is cracking the whip on healthcare professionals and he's also highlighting the contacting, testing and tracing process that is being done for COVID-19. So he starts off by saying that there are 554 confirmed cases in South Africa as of the 24th of March today. But he is also saying that that number is steadily increasing and hence the lockdown that is coming on the 26th of March. He then goes on to describe that the only way for us to flatten the curve is to test people, isolate those who are positive and trace all their contacts so that we can identify, test and quarantine and maybe even isolate those people who are also positive that have been in contact with the positive case. Now, this is a lot of testing that needs to be done, and to date, there are over 12,000 tests that have been done in South Africa. 2,000 plus of those have been done by the NICD, but 10,000 plus have been done in the private sector. But we seem to have run into a problem because some of the forms that have been filled in are missing information. So you'll see in his report that he breaks down province by province where the positive cases are. But there are some people who are not allocated a province, and that is because of the fact that some of the forms haven't been filled in correctly. And so he is issuing a very stern warning to healthcare professionals that yes, we may be in a time where we're under high pressure, but we need to be making sure that our record keeping is appropriate so that we can identify and trace all those people who have been in contact with positive cases. So at the moment, what's happening is that some people who are coming back with positive tests don't have all the appropriate information on their forms, and this makes it difficult for the NICD to then go ahead and start tracing the people that were in contact with that person. And so this is becoming a logistical and administrative nightmare, and so he is urging healthcare professionals to ensure that they are collecting all the relevant information, and that if we don't do it, we could even go to jail for up to 10 years in some cases. So this is a very, very clear directive from our health minister. But he also goes on to say that once a positive case has been identified, you will be required to hand in what's called a contact list. And what that is a list of people that you have been in contact with from 2 days before you started to develop symptoms. So let's say, for example, I got symptoms today, it's Tuesday. Everybody that I was in contact with from 2 days before today, which is from Sunday, I would have to hand in all those people's names so that they can be traced. He then goes on to say that he's aware that there's a debate at the moment with regards to access to medical information. So some people may say, hey, look, it's my medical information and I'm not going to give it to you. But he said that in some cases, if people are being obstructive and who are not complying, that there is a regulation that entitles them to make a public statement, including issuing your name, so that anybody who's been in contact with you can then go ahead and contact the health department for tracing and testing. So very interesting and very reassuring to see that we are being incredibly clear on the directive that we have as a country. So there you have it, a call for us to all be accountable and to all play our part in curbing the pandemic of COVID-19.